Good evening, everybody. So we are back from Reveal Laser with one more session of Expert Lounge. So hope everybody is well, everybody is healthy, restrictions are going off, and today we have a very academic, interesting topic, something which we have must have heard in conferences, read, but we will have a more clearer perspective of the same. So we have Dr. Rajetha Damisetty from Hyderabad to take us through evolution of LHR, laser hair removal. So from where it started, how is the journey, and more on the applicative part, like what laser hair removal used to be, what is the current scenario, of course, little bit of COVID impact, what's the people's expectation when 10 years back or 8 years back a person walks into a clinic was and what it is now. And of course, the technical aspects of the medical part and the machines of the different machines. I'm sure she'll be giving us an Indian perspective, more details. A little about Dr. Rajetha. Most of us know her very well. She has more than 13 years of experience. She is member of a lot of great associations like the American Academy of Dermatology, European Academy of Dermatology, ADVL. We also know her as very active in conferences, presenting excellent sessions, conducting very good workshops. She has spearheaded the setup of one of the best chain clinics of India, Oliva Skin Clinic. And without wasting much time, it's a short and brief session. As usual, we'll have Dr. Neeraj Pandey from Lucknow joining in and, of course, moderating the session for us, making it more and more entertaining. So, yes, thank you for joining back at a short notice once again. Thank you, Dr. Rajita. Thank you, Dr. Neeraj. So, we will start the session over. So over to Dr. Rajita.
Good evening, everybody. Should I start off?
Yes, ma'am. Stage is all yours.
Thank you. It's truly a pleasure to be with all of you this evening. And Neeraj is practically like family, friends of the family that you get to choose. And I have a very special interest in Reveal lasers because I'm really fond of the technology that they make. And I'm very excited about what's to come. So over the next 15-20 minutes, I'm delighted to be speaking to you all about how laser hair reduction has evolved over the past 2 decades or so, and talk about what's there in the market right now, where each of those vis-a-vis the old stuff that we were doing. And after my talk, I'm looking forward to interacting with Neeraj, and both of us together are going to lay out some very practical aspects for all the viewers. And like I said in the teaser video, whether you are an expert and you've been doing this for ages, or whether you're a beginner and you're wondering whether this is the machine or that one should be the one to buy, probably this is going to be the session that will help you make up your mind. And if you already own a technology or two, you might want to decide about how to use which one so that you get better results. Now, now this here is actually not a true representation of how laser hair reduction started, because even when we started, things were not all that primitive, but I think right now we are like really advanced. So yeah, no conflict of interest is a slightly tricky thing here, because I am quite fond of the Reveal team and their machine. So yes, I guess there is an obvious conflict there. And I have to tell you that my main conflict is that I love technologies, and in particular, I love in-motion technology. So that is a conflict. So now, if you are looking at buying a new machine, then do you want to invest big in a laser hair reduction machine? Or do you think that anyway, it doesn't matter, it has become like one commodity, that any cheap machine is going to do the job, because that's not something that a doctor would do? Then let me tell you that the sheer numbers of people who want or need laser hair reduction is high. And the moment you have it in your clinic, even if you don't actively market it, you're going to see that the demand always existed. Now, what other options are there for people who have unwanted hair? Okay, we have waxing, threading, but the sheer freedom that you have once you've gotten yourself laced for hair reduction is very impressive. And it's an easy technology to learn most of the time. It's easy to delegate. You a great way of looking at it is, while you are doing the diagnosis and writing the prescriptions and doing more intricate stuff like your Q-switch YAG or your pico lasers or your microneedling radiofrequency or your subsections, this is something that your technician could be doing. And not only is it going to generate revenue for you, but it is going to keep satisfying the needs of your existing clientele, your patient load. So, we all know that these options are available. But if you want true freedom, and we call it laser hair reduction, and Neeraj and I are going to talk a little bit about who needs maintenance, whether maintenance is needed for all body parts, does it depend on you or your patient or the hormonal status, all that we are going to talk about. So, removing hair started in the medieval times. By the Roman Empire times, it was well established. Cleopatra not only popularized chemical peels, but she also got people of her times to use very primitive pumice stones like razors. And 2 centuries ago, the first razor was used. And of course, in shaving technology, also a lot of changes have happened. But that's not really an option if you want true freedom, because you know that it's going to come right back. So it is, and if you look at the convenience and even the cost of the time that you spend on your waxing, then it is actually affordable. There is absolutely no doubt that in today's world, we can do it safely. And now, is it always reliable? Does it work after a given point of time once your hair has become finer? Those are the things that we are going to debate today. So in my hands and in the hands of most good dermatologists today, even fine hair can be tackled, but not vellus hair. So I will talk a little bit about that during the discussion. So this is how the evolution happened. In way back in 1995 itself, IPL existed, and the earliest laser hair reduction machines actually had the 755 alexandrite and the 810 diode, but not together. They were existed separately. By 2000, which was the year that I joined PG, the long pulsed NDAG had come, and 2006 was the year of change for me in terms of LHR. And that is when this fantastic concept called the in-motion technology started. And 2016 was when the triple wavelength was introduced. So, and 2019 is my current favorite, the 755 and 810 combo. That was when it came. So, when you want to talk about laser hair reduction technology, right now, the options you have are, do you want to do a conventional stamping mode, or do you want to do in motion, or do you want to do both depending on the circumstances? And whether you want to choose a single wavelength or multiple wavelength. And if it is single, then do you want to use a 810 or a 1064? Right now, I don't think Indians are ready for a 755 standalone. And if it is multiple, then do you want a 2 or a 3 or a 4? And if it is a 3 or a 4, then which 3, which 4? These are the important questions that I'm going to talk about. And then the machine specifications. How powerful do you want your machine to be? Are you looking at a 4,800 or just a 2,000? Will that be enough? Or do you want a solid state generated 1064, or will a semiconductor diode generated wavelength be enough for you? What spot size do you want? What speed would you like? And then, of course, the manufacturer, and not the least, though the last in this list is the distributor, because any machine can fail and you need to find a good distributor to have your back. So I'm hoping to answer all these questions. I will come back to this slide eventually. So I'm going to show you how conventional LHR is done. So very patiently, spot by spot, with a 10% overlap. And if you can do this, then this is fantastic. But if your therapist is going to do something like this, then you're going to end up with trouble because you will have these little diamond shaped skip areas. Now, if your therapist is a little tired towards the end of the day, maybe, then you might end up with a patient coming back on day 3, day 4 with zebra stripes. So I once worked with a ages ago in 2008 to 9 when I was working in Kaya, and we had this fantastic 1064 Cutera machine. We had a therapist who specialized in creating zebra stripes and tiger stripes. So his skill, he was known for his skip areas. So we would do what we called a session B. So, because session 1 is over, so you can't do a session 1 again. And you can't do a session 2 because then in the software, you would have to consume what the patient had paid for. So it had to become a session B, and it was quite a bit of trouble. So once in a while, a session B is okay. But imagine if this is going to keep happening all the time. So for small areas, let's say the lower face, the upper neck, the upper lip, even underarm, so conventional laser hair reduction is great. But if you have large areas like the arms and the legs and the chest and the back, then you would want something that is not so prone to creating skip areas. Now, if somebody is angry with you, your therapist is upset with you, and then they overlap, and then you're going to end up with these fish shaped burns. These are overlap burns. These are not caused because of excessive fluence or because of the wrong pulse width. They happen because where the overlap should have been less than 20%, it was way too much. And I have noticed that with conventional LHR, typically we use it only for small areas where you have really coarse hair. The burns have happened either at the end of the shift or at the end of the tenure. We once had a fantastic therapist who, on her very last day, the last procedure that she did, she created such bad blisters, and we had to actually drain it. So it is very person dependent. So if you have great patients, yes, but everybody is human, and you don't want to be dependent on human patience and skill. So the skip areas, the overlap burns. Now, if somebody has pain while we are doing this conventional laser hair reduction, then you could use topical anesthesia, but you cannot use it for large areas because the maximum area that you can cover with topical anesthesia would be just 200 centimeters square, and a typical human being would be at least 1.6 meters square. So if you want to do a whole body laser, you can't possibly, even if you could afford it, even if your patient is going to pay for the topical anesthesia, which is very expensive, you can't really use it because there were 2 deaths reported caused by topical anesthesia toxicity. See, these are going to cause arrhythmias because they are basically antiarrhythmics. Lidocaine is an antiarrhythmic, class 1. So what do? We compromise on the efficacy by reducing the fluids. And then you have no answer for the fine hair. And of course, white hair escapes. You will have to do it very carefully, patiently. So, and one thing that is quite unacceptable is a burn when you're doing laser hair reduction. Now, if you're treating some kind of a bad scar and you create some PIH, then that the patient can understand and forgive you. But these kind of things are the things that might take you to the wrong side of social media. In today's world, if the world is a click away and you don't want to be party to this thing. So these kind of sequelae, and the worst sequelae, believe me, are the hypopigmented ones. And some of us are prone to hypopigmentation after burns. So maybe this time Neeraj and I'll talk about how to deal with this if it happens. But I suggest that you do your best to avoid it. So this is a video of the InMotion technology. I'm not going to play the whole thing. So basically you're going to use a low fluence, repeated passes. And here in this particular patient, the fluence used was 6 joules per centimeter square. But per grid of 100 centimeters square, we were delivering almost 8 kilojoules. So it was quite painless, and we ended up giving effective fluence of almost 75 joules. This was with the 810 diode. So in motion technology is an amazing technology because one, you're no longer dependent on the chromophore melanin in the hair. You are also going to heat up the entire dermis. The way I think of dermis is like a swimming pool with a cover on it, which is the epidermis, and you've got these appendages floating around. So even if you have a relatively lesser amount of melanin in your finer hair, because you're going to go repeatedly on the same area, you're going to build up the heat to take the entire dermis temperature to almost 45 degrees, and at 45 to even 50 degrees. And once your bulge stem cell reaches a 45 to 50, then most of it is going to die. So that is where you want to be. You actually don't need to heat up your hair root to 60 degrees. So once your hair follicle is in dermal equilibrium with the surrounding tissue, even if you have relatively finer hair, you will get away. So, and this is based on the theory of the extended photodermolysis rather than just the selective photodermolysis. So one more important thing is that when you do this, do not expect the same kind of endpoints that you're used to doing, seeing with your conventional or your stamping mode. So these stamping, typically the non-contact ones and all, you expect this popping of hair, and that is because not because you've very effectively treated the bulge area stem cell, but because you've actually targeted the hair follicle root. So you don't need to actually treat this. All you want to do is to go to this area, and if you're able to kill it, then you don't need the popping. So if you're going to look for erythema, perifollicular edema, popping of hair, then no, you will not find it, because you do not need to find it when you're going to do in motion technology. That's something very important for a user to understand. And for all those of you who think that perifollicular edema and popping is a sign of effective hair reduction, then no, then it is time you change your concepts. So a conventional or a stamping laser hair reduction would have a high fluence and a single pass, but a low cumulative. There is no concept of a cumulative energy. So there is a low average part. Whereas in motion, you have a low fluence, but multiple passes. So you do not have to worry about skip areas or about overlap burn. And effectively, you're going to be delivering a high cumulative energy and effectively a higher accumulated fluence. And of course, it is not painful. Now, depending on the combination that you're using, the in motion technology can be painful or painless or almost painless. So when I say that, what I mean is, if you're going to do only a diode, it is 810, it is kind of painful. 755 is quite painless because it has a relatively lower absorption coefficient. And if you're going to do a combination with 1064 or a 1060, then it can become extremely painful. Even in motion technology can be extremely painful. So that the pain factor in motion technology is actually dependent on the wavelengths that are used. But of course, even then it will be far less painful than the stamping method. And obviously no anesthetic can be required even for bikini area, and minimal side effects, and it treats a long thin hair as well, but it does not treat vellus hair. So please remember, if you have to tilt the face like this and see it with one dermoscope, then probably they're better suited for a laser toning and a bleaching of hair using your Q-switch laser rather than a laser hair reduction. So now here I've written that conventional LHR, that is stamping mode, doesn't treat fine hair unless the pulse widths are super low. The problem with super low pulse widths is that, the epidermis has a TRP of 10 milliseconds. So you cannot go lower than that. So if you have such a fine hair that it has a TRP which is less than that of the epidermis, then you're going to get into trouble, because then the epidermis is going to burn. So please don't fall for that, because when the machines originally came, they were machines with 3 milliseconds pulse width, but now they don't really exist. And regarding a tunable pulse width, I'm going to say, I don't have that much time. So yes, so multiple passes versus single pass, the non-inferiority has been proven. Now there are, so if in motion technology is so great, then why do we need stamping at all? You need it still, because there are some areas where you can't move, like the mid-brow area, like the upper lip. Actually you could do like the toes, like the knuckles and the pinna. So there you need this. Now coming to which wavelengths to combine, 755 is a very well absorbed laser. Its absorption coefficient is 25% more than that of 810 and almost 60% more than 1064. So even a little bit of 755 is going to be very well absorbed. And between 810 and 1064, though you can't really make out in this slide because it is a logarithmic ratio, logarithmic scale over here, the 810 is much better absorbed than 1064. So do I still need my 1064 at all? Now, if I had a large practice of pilonidal sinuses where you have like super deep hair, then yes. But now that you understand that you don't have to go to the bottom of the dermal papilla, all you need to do is to go till the bulge, and the deepest hairs bulge also 810 would be able to go. So that is one reason why 755 and 810 together is my favorite combination. Now, is there a case of, so why do we need multiple wavelengths? One, you have varied depth of follicles. So sometimes you have rather deep ones. And the main problem is not that. The problem is once you've done your initial sessions, maybe 3 or 4 or 5 or how many ever, you're going to end up with fine long hair. And if you don't have a very highly absorbed wavelength like 755, you might hit a dead end. For this reason, I love my 755. So the bulge is what you need to hit. The bulb doesn't really matter. The papilla doesn't need to be treated at all. If you're going to go all the way, fine, if you have that technology, but you don't need to. For effective permanent hair reduction, you do not need to target the papilla at all. So now the controversy, which wavelengths to combine? So do we need a 1064 at all? So you've heard me, 810 is enough to go till the deepest. Now, if I have to choose between two wavelengths and leave out either 755 or 1064, then obviously I don't want to leave out 755, because this whole advancement these days is about tackling finer hair, because we are all pretty decent at treating body hair which is coarse. But what happens when you hit that dead end? So I do want my 755, and the best combination for it would be 810 in my opinion. Now there are a lot of people who talk about how a true machine, a good machine, has to be a solid state generated Alex or a solid state generated 1064. So if you want a 1064, then yes, a solid state generated one is better. But if it is about 755, because of the need for lesser energy, because it is very highly absorbed, even a semiconductor generated one is pretty good, particularly if it is in combination. So this is a patient who came to me at age 18 with this kind of hair, and I diagnosed PCOS and insulin resistance, and I referred her to an endocrinologist. That time she weighed 1 or 2 kgs or so, and she did not come back to me for a few years. Her parents did not want her to take hormonal medication. Then towards the end of her engineering course, by age 21, 22, she came back, and we put her on Crisanta. Again, I apologize for using the brand names, no conflict of interest there. Crisanta is drospirenone 3 mg with ethinyl estradiol 2 mg, along with spironolactone. We started off with 100, went up to 150, but reduced it again because she was prone to hyponatremia. And she was on metformin 1 gram a day when she developed frank diabetes. So then my endocrinologist friend put her on sitagliptin metformin combination. And during this period, I managed to do between November 18 and August 19, we did 3 sessions. So I started with a conventional diode, and then I went on to a in motion diode, and her face, the medial part of the cheeks had finer hair, so I did a in motion LX for that, and she did extremely well during this process. She lost almost some 18 kgs to she went down to some 82 kgs, and so at this point of time she was able to maintain this kind of appearance, and she was happy to go around like this because she was used to this kind of hair, and she was happy to come back for LHR only once in 6 months. So now that by a lot of people's standards would be maintenance. So that means in the active phase we did only 3 sessions, which is phenomenal, I would say. And that is possible not only because we know how to use the technology and choose the parameters, but also because of the hormonal control that she had. So now, so why choose a combination? Or now I am used to doing a 810 separately and a 755 separately before the combination came. So those days what we used to do was we used to begin with 810. Once it became less cost, we used to move on to the 755. But once, if you want to delegate the decision making to your therapist, if you don't want to keep going to the LHR room all the time for each part, then of course a combination would be great. The protocols would be simpler, and there probably would be fewer sessions, though the jury is not out on this, because you don't have great head-to-head comparisons, because you know that 2016 is when the first combination wavelengths came. There are some good papers showing that they work, but not that they are better actually. So this is one such study published in 2020, just last year, and they found that it was safe and effective, but they could not really compare it with a standalone 810 or a standalone standalone 755 actually doesn't make sense for our skin types at all. So no, I'm going to skip this because I'm running out of time. So now next question is which combination? So this was the original combination which was introduced by Alma, 755, 810 and the 1064. And then came the primeless combination, which did away with the 755, and it still had the 1060. So, and I told you why I prefer the 755 one. And then came the 2D, and I realized that it actually solves all the needs that we have. Now, off late, you have even the quadruple combination from Miles Men. And then I guess the next one to do would be a 5 combination, add a Ruby to this, and then you are back to IPL days, back to 1995 days. So, I mean, I think that is overkill. So you want to keep doing new things just for the sake of it, fine, but it also has to make sense. So this one doesn't really make a lot of sense to me. So these are the options that are available. So now which LHR technology do we choose? Conventional or in motion? I would say both, because you have to be prepared for whole body hair reductions. Single or multiple wavelengths? Certainly, I think multiple wavelengths. Now, whether at a time or separately is a different story, but if you want to tackle finer hair, then you certainly want your in motion, and you want your 755 as well. Now, machine specifications, please get over this fixation with the solid state thing. And one last thing I want to tell you, there are some purists who want a machine which will allow them to change pulse width from 10 milliseconds to 12 milliseconds to 15 milliseconds to 18 milliseconds. Now, you don't really need all those things. So the most of the good manufacturers don't give you that kind of tunable technology. If at all, you have like a 10 milliseconds and a 30 milliseconds and a 100 and maybe a 400. So you don't really need that much, because you're not really going to change the pulse width for each particular hair. Now, there is a variable TRT, we understand, depending on the thickness of the hair, but you don't really have to sit and do that. So there are purists who are obsessed with that, but I suggest all those of you who are young at heart, give up that idea. So power, yes, you need decent power. You don't need a great deal of power. You're not talking about a pico laser. You're talking about just laser hair reduction. So diode generated, semiconductor generated wins for me because of the sheer cost. Now you are okay to take a loan or maybe put up your savings and then invest, but how much are you willing to spend for the maintenance? Like the this Qterra machine that I told you, the 1064 one, we spent a fortune on it, and it hurts me to think of the money that we've spent. So spot size, now if you're thinking of large body parts, obviously a larger spot size helps. And the shape, now I think most people are out of the round shape, so a square or a rectangle is easier, and faster the better, because one, it is room consumption is going to be less, your patients are going to be less tired sitting there in the cold with the cold gel, your therapists are going to be less tired. So yes, faster is better. Definitely the manufacturer and the distributor, the service provider, you will have to do your homework, do your due diligence before you spend your money and invest. So remember that both these things will take you from point A to point B, and there is a world of difference. So if you want to buy something that is cheap and best, there is nothing like cheap and best. It does not exist. But remember that if two people have a Ferrari, then Shoemaker is going to win. I mean, I hope he's doing okay, and I'm not sure if he's ever going to drive, but you know what I'm trying to say. The driver makes a difference. So please make sure, even after you buy your machine, that you know how to use it, that you want to be the shoemaker of your machines. Thank you so much. And now I will make way for Neeraj to take center stage.
Yeah. Dr. Rajetha is a rock star as usual. With its enlightening, exciting, enthralling presentation. You covered almost everything. So there's hardly anything left to ask, but yes, there are few practical things which we, I'll say, suffer and see in our regular day-to-day practice with various kind of machines. It's almost 15 years that we both are using different kind of lasers for LHR. We started with long time back with NDIAG long pulse, and then to diode, and then to this the standalone that platforms of IPL and NDIAG, then coming to this dual wavelength, triple wavelength of late, and then there is polychromatic this. So there's a long evolution which has taken place since 1996 when the LHR was first approved by US FDA. Now I'll coming, see, this is a question you have to take me like a beginner. See, we are into now fellowships, and my students normally ask me, see, which is the best machine to buy, sir? So then they give us a long example of machine, this machine. I won't quote the names of those companies, but the technologies, if we can talk about, which is the best technology to invest in, then coming on to it becomes even more difficult. See, when the same technology that say the triple wavelength is, see, from the X machine is something around 45 lakhs, and from the Y is something around 20 lakhs, half of that. So which machine to go for? It becomes always a mirage for all of us. So this is one right from the expert.
Okay, so that's probably the toughest question. And normally I hate to give these cat on the wall answers. I am very clear. But here you have to understand, one, your budget, whether you want to stick to only hirsutism kind of things, or you are open to, suppose a patient asks you, doc, I want to get my legs laced or my arms laced, and you might be a very prim and proper old school person, but do you want to say no to this lady or to a metrosexual male? So I would say that, you have to spend a certain basic amount, so you can't have cheap and best. But beyond that, is that extra money going to give you a ROI? Because for that, Neeraj is the person to go to. I am not, so I am more of a, like, I would rather, somebody pays me a salary, I'll go do a 9 to 4 job kind of a person. Basically, I was forced to do certain things in my life, and
I'll come on to that ROI, but before that, there are three things which we see into this. I'll come on to again. There's something like conventional stamping, then there is in motion, and there is one company sells that vacuum assisted also.
Absolutely.
So it's confusing for all of us. So what we should, because I find everything very this interesting.
Now, I would say you have to be geared up for large body parts and small body parts, which means that you need a good in motion technology if you want to adapt to today's world, because the days where patients would grin and bear the pain are over. And if you make it, if you had to do a whole body 1064 like we used to do those days, I don't know how people used to tolerate it. Now it's miraculous. Now that there are options, people are not going to. And the other thing is, when you can do something painlessly, do you want to inflict pain? As a human being. So I don't want to, Neeraj doesn't want to. So I think in motion certainly scores. And obviously only in motion is not possible because there are going to be areas where you can't move. So you need a combination. That is one thing that is clear. And you need a great cooling because that will ensure safety, that will ensure comfort.
Okay, great. And then this.
And you need a sturdy machine because you can't have the machine, you can't keep putting it aside for repairs.
Mm-hmm. Then this reducing pain is directly proportional to cost increase. See, there's a price hike in the price. This is what, because if you're using say single frequency, a single this, then the chances of pain are more. You keep on going on to this, improvising the machine, and then gradually it increases the price bracket also. So then you have to be, again it comes to the square one, whether you are a beginner, what kind of practice you want, and then end of the day, suppose if after 15 years of practice I am buying, I might go for the triple wavelength, the best machine, because it gives you a marketing edge also in this fraternity. But if you are a beginner, then it depends on what kind of background you have and how you want to jump into the market with all kind of big guns, or you can start with the mediocre machines and then gradually buy after upgrade. Because anyways, these machines have a this life of something around 5 to 7 years, as either a new technology comes or the machine lives. There is something, this machine breakdown is there. See, there are only few good machines which I have seen goes for more than 8 to 10 years, or either you use it for 8 to 10 years. You tend to buy something or other because demand is always there. So with this, it again leaves us in dilemma which machines to buy. It varies from person to person, time to time, city to city, and then what kind of mindset you have and what kind of pocket you have. So this is not a very easy question to answer.
Very well
Now
said.
coming,
Lovely.
yes, it's not an easy question to answer. See your pocket, then ask your seniors and ask which is the best. And if something like patient come to us, sir, paise ki koi baat nahi hai, whatever you want to do, please do the best thing. Then it's our choice what to do. Similarly, if when you are buying a machine, there's pocket, and right from the technology to pocket, everything matters. Now coming on to this, ma'am, one very practical question. What are the exclusion criteria in your practice for LHR? Do you ever refuse a patient? And if you refuse, when it is exact?
Now, I've learned that when a patient makes me feel uncomfortable, there are some patients whom you don't look forward to seeing. You see their name in your appointment list and you feel,
Yes.
You don't want to see them. So I've learned to say no. I'll give some excuse. I'm being extremely honest here. And the next one is the, unrealistic expectations, or somebody has this wellness hair and they say, doctor, do you want to use that instrument and see? And then they say, I can see it with my dermoscope, but my laser machine can't see it. So then that is when we will end up in trouble. But other than that, laser hair reduction is easy. If you can see a good contrast between the hair and the skin, then that is good. But I also say no to men who want to do beard shaping in weird shapes, like over here. So sometimes, Neeraj, they want like a funny kind of a thing. And remember that this is all androgen dependent. And we are struggling hard enough to reduce the androgen in women, in hirsute women. So how am I going to tackle this without giving this man a moth-eaten alopecia kind of appearance? So for me, beard shaping would be from the tragus till the lip corner.
Yes, that's right.
I don't do this part or not. That is another strict no.
Mm-hmm. See, laser in special populations, laser in pregnancy, laser in lactating mothers, should we do it? It's a big debate which is going on of that. Should we do it? But many of us think that it's a very safe procedure. Nothing is what laser is going to do. Should we do it or not? Other than, see, one, there is definitely it probably it, because because it's not been studied, so it can raise a medical legal issue. But other than this, what are the practical reasons that we should either do this LHR in pregnancy, or either we should not do it? Which group do you belong?
LHR in pregnancy, no, I do not want to do, because one, today's women will have 1 or 2 children, and pregnancy is a short-lived period. And laser hair reduction is certainly going to be, you can certainly put it off. Now, there are people who say that, the wavelength we use, it does not go even till sub-Q. So it is not going to go beyond the uterus. So we know that physics.
Okay.
We understand that. But the problem is not that the laser is going to penetrate and do some direct, fetal malformation. The problem is, let us say you've done a facial laser. Now, obviously, you're not going to plan to do like legs and arms and underarms. If at all you want to treat a lady during her pregnancy, it will be for hirsutism. Thick, coarse hair. Let's say she gets in secondary infection. There is a herpes outbreak. You want to give her an antibiotic. You want to give her an antiviral. Why do you want to, or you created a burn inadvertently, then you want to prevent a PIH. So you would normally give, like I would give a tranexamic acid to prevent PIH if at all there's a hair reduction burn. So do I want to get into all that? And tomorrow, see, now US is full of obstetricians who are being sued because kids are not doing well in school, in high school.
Yes.
And that is because they think some birth trauma did that. Now, I certainly don't want to get into all that stuff. So once I was, with your permission, Neeraj, I'll take 30 seconds. So I was once moderating a session, and one of the doctors, very senior man, said that he did twice because the women's husband said that he would divorce her. Pregnant women, she has hirsutism and he's threatening divorce. And I said, you know what? I would encourage her to take the divorce.
Yes.
The man is certainly
that's what we
the risk is not.
Actually, that's, she can shave it off. That's a different thing. But there are other scientific reason also. See, if you see the higher levels of estrogen and androgen during pregnancy, can change the duration of phases of hair cycle. So we can end up doing in a wrong phase, something like, because you're not getting that anagen phase every time when you're in pregnancy you are doing it. So this is one bigger reason during in pregnancy and lactating mother we should not do LHR. This is what I always say. And why to invite a medical legal case on you? Never know, because it won't be easy to save yourself. If somebody asks question why you have done it during pregnancy, it won't be easy to justify it. So that's different. It's all your. Having said that, it doesn't mean it's your call, but you have to see all these factors and then decide how justified it is to do LHR during pregnancy and in lactating mother.
Obviously, you can't give any anti-androgen, so your results will be so-so.
Yes, ma'am. Now coming on to this, when you are starting a laser, so do you work up and do you do investigation in each and every patient, or what set of patient how do you select it? And then what are the basic investigation which you do?
Okay, so every women with hirsutism who comes to me for LHR or for something else, maybe she's come only for hair loss or for acne also, I would still investigate. And I would ask for the first, if there's very limited budget, which is not usually the case, I would ask for a TSH and a prolactin. And I would clinically examine for signs of ACTH excess and growth hormone excess. So we dermatologists are experts at causing it and detecting it also. Yes. So Cushingoid habitus. So that I would. And I would also ask for an ultrasound. And then I would also ask for a total testosterone, not a free testosterone, because free testosterone, in the way they do anywhere in the world, is not using equilibrium dialysis. So it is not going to be very accurate. So why do I want a total testosterone? Because if it is very high, then I know that it is not PCOS. I know that it is either a tumor or hyperthecosis, which is a severe variant of PCOS. But what is the most common cause of hirsutism? It is PCOS. In 90% almost, it is PCOS. Yes. So if you know that your TSH and prolactin are not way too off and there are irregular cycles, you already have a diagnosis. If the cycles are regular also, but the ultrasound, particularly a transvaginal ultrasound, is the one to look for. But if a lady is unmarried, obviously you can't ask for it. So if you have a polycystic ovarian morphology and ultrasound, then you have a diagnosis.
Okay, then two things. See, there can be a clinical PCOD also in which you don't get radiological features specifically. You send the patient and every time they come with this, my ultrasound is normal. There's one more investigation which I do in my regular practice. It's a marker of AMH, anti-Mullerian hormone. See, when I start, the first few investigations are like thyroid, AMH, serum prolactin, and maybe ultrasound. Initially, just 3 tests, and then they guide them. There are a few investigation which has to be done on the specific days of your pregnancy. So that how we proceed. But most of the time, you see clinical this features and you diagnose as a clinical PCOD, and
Yes.
then you have to stick on to that. So don't worry about this whether it comes in ultrasound or not. This is how I practice. I
Yeah.
don't know. I'll take your opinion.
There's only one problem with AMH. One, the assay method is not very clear. So the smaller towns and all won't have very good methods. Second is AMH reduces with age naturally because it's a measure of your ovarian reserve. So you don't have a age bound cutoffs as of now. So you might end up, if you're dependent only on AMH, then you will end up underdiagnosing in older people. And also the cutoff is not clear.
In young age, it's very, very this. Most of the time, about 45, I generally don't do. I go for other investigation. But
right. So if it is
unmarried girl, it gives you an idea.
So if you have a young woman who is unmarried, then AMH is a great test.
Yes.
If it is a married woman, I would still prefer a transvaginal ultrasound.
Fair enough. And then how often you give anti-androgen therapies? And do you refer it to endocrinologist or do you treat yourself once you diagnose?
For all moderate and severe hirsutism patients, I give anti-androgens.
Okay.
For mild ones also, I might, depending on how they respond to the first 2-3 sessions.
But even with a normal hormonal profile?
Absolutely, because in PCOS, that is what you expect. PCOS is not PCOS if there is abnormal hormonal profile. The only abnormality that you're going to expect is a abnormal HOMA-IR or a high fasting insulin, or maybe a PP insulin, which doesn't matter. So I don't really ask for it. So if it is abnormal hormonal profile, it is not PCOS.
Okay, great. I do my LHR. Normally, I have an endocrinologist friend. I refer the patient with this caption and caution that I feel that she is PCOD and I'm 100% sure. Rest, it's yours. Okay, so they keep on doing their work because end of the day, what I have seen initially, I was doing it in my early stage of practice. What happened every time when they see if there is a, I generally don't say failure of LHR. If the patient is not satisfied, say after 8-10 sessions, they used to say, Doctor साहब आपकी दवाई भी खाई, आपका लेजर भी लिया, but it didn't work. आपकी दवा ने भी काम नहीं किया. So they think when these two things are combined, they generally, and then there are two doctors, the onus is always on the two doctors. This is what I always felt in the practice. So I refer them to my endocrinologist friend.
So I might refer, but mostly I don't. If it is garden variety PCOS, I don't. But if there is something else going on, like a non-classic congenital adrenal hyperplasia, a prolactinemia, a frank diabetes, or super VIPs, or fussy patients, then I would refer. So there is a significant chunk. And if I am referring, either I'm monitoring the patient myself, or I'm monitoring my friend who's the endocrinologist. But it's important that you have a great rapport with the endocrinologist, like Neeraj has with his, and I have with the one I refer to. Because you can't have someone who says, this laser doesn't work, your hormones are normal, you go away, or you eat 1200 calorie diet. Now, who knows what a 1200 calorie diet is? I don't know, in spite of reading up so much.
Yeah, we will take a question from the audience. Dr. Rajesh Buddhadev has asked a question. The accepted minimum age to begin laser removal can be as young as 14 years old. Do you agree on this?
Absolutely.
I don't know how it's accepted. Is it accepted?
So accepted in the sense that 2 years after menarche is a good time, and typically you expect menarche age to be around 12. But the youngest I have personally done is a 12-year-old girl who was being bullied in school because she had a mustache,
What I used to say, anything with psychological reason, we generally do in early ages. Otherwise, I wait till 16 years and then I do it. This is still the old school of thought which we follow.
16 or 15?
This is what? 16.
16.
Normally, what we used to do, initially it was 18, it became 16, now it's 14. And then the way lasers are coming and the companies are researching, it can be in the neonatal, this also. If you see only one year, you can do laser. So you have to use your brain when to do it exactly. I generally think 14 is not the age. Somehow, I generally wait and then counsel them. But sometimes if it's cases like this, that there are some psychosocial there's reasons to do it, something like going to school and then she's bullied in the school. Yes, we can. This is what I agree with that. So how important is this laser counseling in your practice?
Oh, it is.
How much time do you give for the laser counseling? Do you do it or the staff does it?
So typically I do it and the staff reinforces it. So we
Okay.
keep doing it all the time and every session. So for normal hair reduction, no, it's not a hormone dependent area, arms, legs and all. Typically we talk about 6 to 8 sessions plus minus 2, because you can have somebody who's dark skin, who's a slow responder. So that gives you a margin. Never commit to a number, give a range.
Yes.
And a simple rule is that the younger the patient is, when you start LHR, the more the number of sessions are going to be. So if a postmenopausal hirsutism lady comes to you at 45, 50, and she doesn't have significant white hair yet, then you're going to be telling her maybe even 6 to 8 sessions or 6 to 10 sessions will do. But if it's a 15-year-old girl, you're going to talk about next 3 years and at least 12 to 14 sessions and then maintenance. And also I say that this number is going to be valid only if your at least 6 sessions are done with complete hormonal control. So when I say hormonal control, the baseline testosterone is normal, but still we want to give a OCP and typically aldactone, spironolactone, or if you can't give it, maybe a bicalutamide or both, and metformin, this whole thing, and weight loss and exercise and sleep cycle and the whole works. So,
Great.
and this we keep talking every time.
So there are two things what I'll with my there are some tips for the beginners. What we counsel generally, all my staff are trained in this. There is a laser hair reduction. As I say, it's a multiple session procedure. There are two phases of it. One is regular phase, one is maintenance. So maintenance also we generally put in right in the first session. And then they ask you when the maintenance comes. It's normally 8 to 10 session, 12 session. Doctor decides depending on your hormone. See, you can't be very straightforward in LHR. See, you have to, it's something like a jalebi and imrati. You have to be always round. So this is what you have to save yourself. End of the day, I always say that there are regular sessions, so something around 8 to 10 sessions. You can give a limit of sessions. The exact sessions can't be predicted. Most of the time, 6 to 8 sessions, if the everything is going fine, then we get good results. And then thereafter, we can counsel them that yes, now the maintenance sessions. And that also plays a major role in the counseling. This is what the staff has to do in your clinic to save
Right.
your life.
Neeraj,
Otherwise, it becomes
I
difficult.
want to say something about maintenance sessions. Now,
Yeah.
6 to 8 is only for normal arms, legs, underarms, those kind of things,
Yeah.
not for hormone
Not for
dependent areas.
yes.
So once when I was a newbie cosmetic dermatologist in Kaya in 2008,
Eight.
the therapist called me and said, Doctor, maintenance 19th session. I was
Ah.
thinking maintenance 19th session means you have one idea that you will have
Ah.
one here, one here, there. You
Ah.
go with one idea. Then I
Yes.
see this girl has got like a thick beard. Like my son would probably be proud if he had that kind of a beard ever. So that kind of a thing. And I was like shaken up. Then I realized, and then I asked her, so she was a newly married girl, Sindhi girl, she was wearing those red bangles and all. I asked her, when was your last period? How were your periods? And she said, 3 months ago, but I know I'm not pregnant. I'm planning to go see the gynec. 19 sessions later. So for all of you,
It has to be.
remember that irrespective of how good your machine is, it will only tackle the hair in the anagen. And that hair in anagen that day can go 3 ways. It can get killed, which is great, or it can get miniaturized and the androgen will stimulate it, or it can go into hibernation and again androgen will stimulate it. So it will be like if you don't control the androgen excess, you're taking 2 steps forward and 1.5 steps backward.
Okay.
So please do it simultaneously.
With this coming on to when you talked about Kaya, there are a lot of things which will come. How do you tackle paradoxical growth then?
So
And what
I
are the,
think
yeah,
the best way is to prevent it. And first, you need to be sure that it is paradoxical hair growth,
paradoxicity? Yes.
or it could also be evolving PCOS or evolving androgen excess. Because let's say we started with 2 shots here. So you're treating those 2, but there is no hormonal medication being given.
Yeah.
So the other hairs are getting stimulated. No, that is not paradoxical. That is evolving evolving hormonal pathology, basically. So, but if you do get it, I am going to quote Dr. Pai, Dr. Ganesh Pai, the answer to more hair is more laser.
More laser. This is what.
So you will have to do, just keep going. And with InMotion technology, because you are not scared of burns and because you're giving a good cumulative energy, typically paradoxical hair hypertrichosis is quite less.
Then there are sometimes leftover thin long hair.
Yes.
See, after doing so many sessions, 15 sessions, 10 sessions, and how to tackle them.
So
And then which wavelength is the best? Because this is more of purposely I'm asking this question.
right. So typically, Neeraj, we've not encountered that because we began with IPL based in motion technology. And then we moved on to a diode and LX, not in the same one. So initially we would start with diode, and even before the hair became super long, we would shift to LX. So, and now again, I have a combination. So I generally don't encounter that problem. But if you encounter it, then 755 in motion would be your answer.
Now we don't see it. Initially, it was the case when we used to use
Because
only
we had
either
to,
long pulse or the
yeah.
stamping mode. That was now. But yes, often we see the other cases. And how do you select your parameters? Because
Okay.
most of the time, whether you are in the clinic, you always see the patient.
Yes.
Because sometimes what happens, I'm sitting in the other clinic and the patient comes. So you have to rely on your laser technician also, or maybe a doctor is there. So what should be the ideal this for them?
No, ideally, I think a doctor should see, but once in a while, I make do with a photograph that my staff sends, and then I can, tell them I can write in a WhatsApp message, but that's not something that I like to do. Sometimes I'm forced to do. I'm being honest here. But every session, and I also don't believe in these oral instructions. I write it down on the form because they can be misunderstanding. Now, Neeraj said 15, I heard it as 16 or vice versa. Sometimes these things can happen,
Yes. And how do the parameters you change at the subsequent sessions?
So
have you given any training to the staff, or what percentage and how to increase that?
Not see with these combination and in motion technologies, typically you don't really have to change parameters. So at the most, you might increase the fluence by 1 because the hair has become finer and the pain factor is going to be anyway less. But if you're doing the conventional mode, typically I would say the coarser the hair, the lesser the fluence. And coarser the hair, the more the pulse width.
Okay, great. And then, do you use multiple technology in the same patient? Suppose diode in the first, you have all the this meters, no? Diode in the first session, then maybe NDX, then LX. When you have so many this,
Yes.
or you just contented with the one which you start with, and on and off depending on the scenario, you keep on changing it.
So as hair gets finer, we used to shift from 810 to 10 to 755. But now I have a combo, so we do the combo.
Okay. Combo in the same session, or?
No, so simultaneously these two wavelengths are being emitted.
We do it all. That's what.
That is the reveal Vega. But earlier I would start with the 810, and after 2, 3, 4 sessions, that point where the hair becomes finer, then we would shift to this.
What to do for the best outcome if you have so many this wavelength machine? Suppose if we have 75, then we are talking about diode and the we have everything. So how to combine them? Is there a set guideline for that, or you have to just it's as per your practical experience and use your brain and then do it? Is there any what is the protocol for that?
So
just for the audience, I want to ask.
At this point of time, you have to rely on your understanding of the laser physics, which is that the absorption coefficient of 755 is much higher. So you need that if you have thinner hair. Whereas if you have coarse hair, then anything will get absorbed. But 755 alone might not be a good idea because it might not go to the bulge area in a coarse hair. So you will have to use your understanding of the skin histology as well as the laser physics.
How frequent this session should be?
Now that's an excellent question.
This is what I want to give this message to the audience.
Thank you so much for bringing this up. Please wait for the anagen.
Yes.
So this giving appointments at monthly intervals, I think, is an extremely outdated concept. I hope nobody is doing it. And if you are, please stop doing it. Because remember that once hair comes into anagen is a long phase. It's going to stay there at least for 2 months. And during this time, some other hair, which were in telogen and ketogen, are also going to join. So this 4 weeks, 6 weeks and all doesn't make sense. So please wait for some significant hair growth. And if you are doing a good job of laser hair reduction, then I believe the minimum interval between first and second should be at least 6 weeks. And as you keep going, the interval can be as long as 3 or even 4 months. The hair is not going to run away from anagen.
The criteria should be complete full growth. This is
Yes.
what we
Only
need.
thing is full growth will keep reducing. So,
Yeah.
so once you see that, okay, 4 months, this is it, the patient is not even shaved, then you can go ahead. And if some patient wants to come back early, at 4 weeks, at 6 weeks, saying, doctor, I have a little bit of hair, I have a function, then we say, we'll do complementary shaving.
Okay. Then coming on to the one question, this is a kind of can be a medical legal question also, and this can be a practical this tip for the audience and the beginners also. Should we regarding the consent form, what kind of consent form should we use for LHR? Should we get it signed on the all these sessions, in subsequent sessions, every session, or should we sign it once for the say 8 sessions, then again sign it after 8 sessions? What is the ideal way to do it? And should we explain each and everything? Suppose like this, all signs should be written in this. This is what you should expect. There can be failure also, and everything. So, what is the ideal consent for LHR?
So IADVL has put up some very good consent forms. It should be a comprehensive, informed, detailed consent to be signed for every session, for every part. Meaning today, if somebody is come for arms, legs, and chin and upper lip, then that day, yes, one thing with mentioning these parts. But day after she comes for some, let's say underarms and something else on side locks, then that day again you will have to take another sign and a proper detailed one.
And this is what very, very important. You should know how to get your consent form filled, and your staff should be trained in this. That every time this is make it sure that the consent form, a new consent form should be signed. Then coming on to this, I don't know, now we don't do it. If you remember, in between there was fashion to use exogenous chromophore, apply something like carbon and then do the laser. I have, I have not tried it long time back. But what do you think about that?
Oh,
Does it make it sense?
I think it's completely outdated.
Yes.
The first time I saw
Long time.
laser being used was in the year 2001. I was a second year PG. And
Mhm.
we paid a huge, handsome sum of 5,000 and went and saw one conference. They were doing this. So it's meaningless.
It's meaningless. Should not be. But still, there are some companies who advocate this. You can use when there is. See, the science behind this is when it's not working, the penetration is deeper, and then the old science is still.
I
And I
think
think that's a myth actually. We are not doing it. It's not. Now coming on to because we already short of time about this phonathine and laser. What so
sorry,
what should we use as a medicine regular topical for along with LHR?
topical post LHR. Post LHR, see, a simple moisturizer will be enough. But if you are thinking in terms of a secondary bacterial infection, you might want to give a 3-day course of antibiotic if somebody is acne prone or folliculitis prone. And there are antibacterial like a mupirocin or a fusidic acid is decent. And there are a lot of people who use something like a fusidic acid and a betamethasone valerate combo on table. And I think that is okay for small parts, but not for large parts.
We'll take some audience question, then we'll
So,
finish it. This Dr. Soha K, she is asking, ma'am, could you explain a little about an ideal TRT thermal relaxation time for finer hair?
okay.
And in advance, she says you thank you.
Okay.
Okay.
Hi, Soha. So, a finer, coarser hair would have a larger dermal relaxation time, and a finer hair will have a smaller dermal relaxation time. And you would ideally want to match the pulse width to the TRT. So, smaller hair will need lesser pulse width, but any pulse width which is less than 10 milliseconds is an extremely risky pulse width. And remember, when you're treating relatively dark skinned people, darker type 4 and type 5, then those are very risky ones. So I would not even dare to use a 15 milliseconds or lesser one. So I would suggest you stay above that, even if it is finer hair. So if you want to tackle finer hair, then the way to do it would be an in-motion technology or a 755.
Finer hair means how fine? Should we go for that or not?
No. So again, if
What?
it's so fine that you can't clearly see it, you have to look at it tangentially and all that, then laser toning is your answer, not
That's what I say. This is one of the exclusion criteria for me. When I see a gray hair, very fine hair, we don't go for LHR. Now there are one more question with just hold on this. Some anonymous attendee. Which laser is good for any laser? Can pilonidal sinus, LHR? What should be the gap? What are the chances of epidermal damage?
So for this, a long pulse 1064 might have an edge over the other things because these are deep-seated hairs. But there is at least one good paper which has shown the efficacy of a 810. Now, epidermal damage is going to depend on the parameters that you use. So if your overlap is right, because it can't be in motion. If your overlap is right, your fluence and your pulse width are matching correctly, then you should not have epidermal damage.
Yes. Should
And
be a stamping rather than
so
the
gap,
conventional stamping mode works on them.
yes, it has to be a conventional stamping mode. And the gap would be depending on the hair growth, like Dr. Neeraj said. So a minimum of 6 weeks for the first and second. And as you keep going, the gap becomes more and more.
Fair enough. And then there is one more, rather than there's one question which, have you ever encountered a patient who says that after laser, suddenly there is rapid graying of hair?
Okay.
This is what is the cause for that, if it happens?
There are two
Does
things.
it happen or is it a myth? This is what
No,
I mean to say.
it is not just a myth. There are some papers which have shown that IPLs can accelerate the gray.
Yes.
And the other more common thing is that, let's say there are 100 hairs with 40 gray, and you've done your LHR and you've reduced some 30 black hair, suddenly the white hair is going to dominate. And also, as you keep aging, obviously at one point of time, that tip off will happen when there is graying. So it is hard to say. So, but I would still go ahead and do it if at least 50% of the hair are black. If more than 50% are white, then I would not advise that.
Okay, this Dr. Shadab Doi is from Gujarat, and he's doing fellowship also. And he's asking a question because he is about to buy new machines.
Okay.
How do you compare a machine with 755, 810 wavelength with one targeting at multiple levels like 755, 810, 1064, and so on?
Okay, so I already told you 1064
Yes.
to add to the pain factor.
Okay.
So I would not want a 1064 ideally. Now, well, once you have the 755 and the 810, then 904 I don't think really adds value. It's like saying that you're using isotretinoin and then you use something else also. Anyway, acne is going to go off.
Yes. See, again, the question is this dual wavelength, triple wavelength. I am a beginner, which one to buy? See, this is what the basic question is.
Right.
Yeah. So this needs to be.
At this point, I think dual wavelength will serve most of our purposes.
Most. Yes. And this is good for reveal also, actually. Coming on to this, Dr. Divya Malhotra is asking, what are the approximate charges of LHR for various areas?
Divya, you'll have to ask my assistant.
And then this is a difficult question. Varies from center to center, city to city, doctor to doctor. See, what I used to charge is something around 14, 15 years back. Now it's different. So varies in machine. Which machine are you using? So laser is, see, in the saloon, the same session can be done in 500 also. And some doctors are doing in 5,000 also. There is a big gap. There is no ideal cost parameter for that. And having said that, I think we are already done with the time. It was a brilliant session, learning. There were so many learning tips for me also. And there's your final words about LHR, Dr. Rajetha, and tips to these budding dermatologists, those who are watching you, and they have learned a lot from you today.
Oh, thank you. So laser hair reduction is something that all dermatologists should be well versed with. Whether or not you own a machine, now you might be referring to somebody else, but you should know how it works. And also, please don't hesitate to invest in it. Please don't hesitate to provide the service, because we are cribbing about other people coming and taking over our work. We are fighting quackery and all that. If all the dermatologists are able to provide some kind of a decent service, then people are not really going to go elsewhere. So for that reason, whether or not you can afford at this point of time, learn the science and be ready for the time or plan ahead.
Yes, agree. And then the final tip from me, see, all technologies are good. See, lots you have learned from this session, but definitely you have to assess the company from which you are buying the machine, who can give you after sales service, and who can share your pain after buying the machine. And there are a lot of other things which you will learn with time. So Thank you very much. Thank you, Reveal. And over to you, Snigdha, for concluding the session.
Thanks. I
Yes.
had a great time.
Thank you, Dr. Rajita. Thank you, Dr. Neeraj. Yes, it indeed was one of the best sessions till now we had on Expert Lounge. We have already started getting messages. That's great session. And yes, we had an attendees of quite young dermats today, people studying, people wanting to invest. And I'm sure this provides a great insight. And as you told, and we will also reiterate that that's the reason Reveal, our machine, the Vega, goes with dual wavelength, most commonly used, most applicable, excellently suited for Indians. So thank you both of you for your time. Thank you the viewers for all your attendance. So stay safe, stay well till we connect next time.
Thank you.
Good night.
Thank
Bye.
you. Good night. Good night, everyone. Thank you. Bye.
Good night.